झालं.
Okay. Good evening, one and all. Myself is Dr. Deepak Bhosle. I am consultant diabetologist at Devgiri Diabetes Care Center, Kalda Corner, Aurangabad. Now today I am going to talk regarding the self-monitoring of blood glucose level in diabetic patients. Before that, so I am going to tell you about what is diabetes, what are the different types of diabetes, how diabetes is diagnosed, and how actually diabetes treatment has been initiated, and there onwards how diabetes is monitored. So before that, so I will be telling you what is diabetes. Diabetes in simple word, it is a metabolic disease where our pancreas, they are not producing the adequate amount of the insulin that is required for controlling the blood glucose level. In addition to that, whatever insulin is produced, that insulin is not able to produce adequate action in the body. So these are the two defects, insulin deficiency and insulin resistance per se causes diabetes. Now if you see the global picture of diabetes, you see as per the data of International Diabetes Federation, around 387 million people, they are suffering from diabetes today. And if you see the projected figure, so it is around plus 205 million by the year 2035. So you can imagine actually huge burden of diabetes we have to face in future. Then the next important thing is about the prevalence of diabetes in India. Now if you see, as per the study conducted by ICMR India, that is ICMR India Diabetes Study, so 77 million people, they are suffering from diabetes in India, and around 100.95 million people, they are likely to get diabetes by the year 2030. And if you see the projected figure by the year 2045, it is again more horrifying. So it is 134 million. And the most important thing about this statistics is equal number of patients, they are roaming in the society who are not diagnosed or who are diagnosed as a pre-diabetics. So that we call it as a state before occurrence of a frank diabetes. Now if you see the various risk factors responsible for causing diabetes, so I will just categorize those risk factors into two different categories. Now the first category is the modifiable risk factor, like physical inactivity. I think today all of us have become physically inactive, that we have observed in last couple of years during lockdown. Then overweight, obesity, fast food, junk food, hypertension, smoking, alcohol, tobacco, and multiple other the addictions. So these all are the modifiable risk factors which are in your hand actually when you are thinking of treatment of a diabetes. And whereas the non-modifiable risk factor include the family history of a diabetes. If your parents, they are diabetic, or any person from your family member, they are diabetic, you are likely to get diabetes. Second is race and ethnicity. It also contribute equally, because in certain region like Asian Indians, they are more vulnerable for development of diabetes. Increasing age itself is one of the important risk factor for development of diabetes. Then history of diabetes during pregnancy, and certain drugs like corticosteroids which we are using in the current pandemic of COVID-19. So after this, I will be explaining you what are the different types of a diabetes. By and large, there are three different types of a diabetes. I will say there are multiple types of a diabetes, but you just remember the three major types of a diabetes. Type 1 diabetes, which usually affects the children, and it is less prevalent. So it is less prevalent to the tune of, maybe you can see out of 100 cases, only 5 to 10 patients, they are getting the type 1 diabetes, where there is no insulin produced in the body. Okay, there is no insulin production in the body because the insulin producing cells in the pancreas, that is beta cell, they are damaged. So this is called as a type 1 diabetes, and the only treatment for treating this diabetes is the insulin therapy from outside. Second type of a diabetes is a type 2 diabetes. In type 2 diabetes, there are two defects. Either there is an insulin deficiency, adequate insulin is not produced, or whatever insulin is produced, that insulin is not working effectively in the peripheral tissue. So this is the dual defect in type 2 diabetes. And the third category is the gestational diabetes. Gestational diabetes means pregnancy it itself is a state of insulin resistance. So any sort of glucose intolerance or any sort of increase in blood glucose level which is first recognized during pregnancy is called as gestational diabetes. So these are the three major types of diabetes. In addition to this, I think the one more common diabetes that we are seeing nowadays is the steroid induced diabetes in clinical practice. Now the next thing is how to diagnose the diabetes. Now it is always whenever we are having signs and symptoms of diabetics like polyuria, that is increased frequency of urination, increased thirst, then the most weight loss, then diminution of vision, then infections of private part, and multiple other symptoms of a diabetes if we are having. And remember, around 50% of the population, they don't have any symptoms of a diabetes when they are diagnosed as a diabetic, because in our hospital we are seeing quite a lot number of insurance patients, so where maybe around 50% of the population, they are suffering from the diabetes and they are absolutely asymptomatic and they don't know they are having diabetes. So how to diagnose diabetes? Now diabetes can be diagnosed by doing the three important tests. Now the first test is the oral glucose tolerance test. Second one is the fasting and post-meal blood glucose level that we are routinely doing in the laboratory. And the third important test is the HbA1c value. Now let us see how to interpret these values in clinical practice. Now any blood glucose level less than 100 is normal. Fasting I am talking. Post-meal anything more than, less than 140 is normal, and HbA1c less than 5.7 is normal. So this is the normal cutoff. But in between the 100 to 126 of a fasting blood glucose level and 140 to 200. Now this gray zone of fasting and prandial blood glucose level and in fact HbA1c between 5.7 to 6.5, it is called as a pre-diabetes, or the condition that precedes the actual frank occurrence of a diabetes. Any fasting blood glucose level more than 126 is diabetes. Any prandial blood glucose level more than 200 is diabetes. Any A1C more than 6.5 is diabetes. And of course, any patient coming in a clinic in a random and having blood glucose level more than 200 with classical symptoms of diabetes is likely to have a diabetes. Now, what are the four important pillars for diabetes treatment? Now, when we start the treatment for diabetic patient, so we have to understand what are the different things that we need to do when we are treating a diabetic patients. Now, the first important thing is the diet. I think diet and exercise, these are the two major pillars for treatment of a diabetes which are most of the time ignored by the patient. And the third important pillar is the medication. Whatever medication prescribed by the doctor, that need to be taken by the patient in adequate dose prescribed by the doctor to the given duration of a time, and subsequently patient should go for the follow-up. And the fourth important pillar of diabetes treatment is, I think, the monitoring, which is I think the much ignored thing in the clinical practice. Now let us see what is self-monitoring of a blood glucose level. Now, as I told you, self-monitoring of a blood glucose level is one of the important pillar of a diabetes treatment, like in addition to diet, exercise, then the various medication and awareness. Why to do the SMBG or the self-monitoring of blood glucose level? Now, this has to be done to assess the changes in the blood glucose level which is happening over the period of time. Why it is important to assess the changes in the glucose control? Because variation in the blood glucose level, too much low and too much high, is always dangerous, and that is known to cause the various complications of a diabetes, which we are going to discuss subsequently. If patients they are doing the self-monitoring of a blood glucose level, there are fair chances that good number of patients they can achieve the HbA1c value less than 7%, and in fact there are studies conducted in the past where patients who are doing the self-monitoring of blood glucose level likely to have more more number of patients reaching the target as compared to those who are not doing the self-monitoring of blood glucose level. Then another important thing is, by asking your patient to do the self-monitoring of a blood glucose level, indirectly you are educating the patient to interpret the result of self-monitoring of a blood glucose level. And of course, the most important thing which is assessed by doing the SMBG is the changes in diet, changes in lifestyle, changes in oral medication done by the doctor. These all things, they can be assessed by doing the self-monitoring of blood glucose level. Self-monitoring, what are the advantages of self-monitoring of blood glucose level? I think it is the most reliable, fast, portable and most acceptable and convenient method of assessing the blood glucose level, which gives you an idea about your status of blood glucose level. But the only disadvantage, I will say, of a self-monitoring of a blood glucose level is the knowledge of doing the SMBG, that is self-monitoring of blood glucose level, and the certain expenses like purchasing a device of glucometer or the purchasing the strips. So these are the only I think the disadvantage. Otherwise, that there is one more addition I will say is the patient related errors that can be observed sometimes. Then self-monitoring of blood glucose level, what are the important things that one must know? Patient-specific needs and goals should be detected. Remember, patient should be educated about the goals of a blood glucose level, which is very important. And the most important thing, along with goal, they should also be educated about testing timings. Okay, so medication regimes. Then the certain situation where the age of the patient is also important, because if patient is elderly, there are less chances that he or she can do SMBG at the own. They need actually some assistance. Then the next important thing is who should do the self-monitoring of a blood glucose level. All type 1 diabetic patient, all type 2 diabetic patient, all gestational diabetic patient or the diabetes with pregnancy patient, patients who are using the insulin pump, and for that matter any patient who is hospitalized or just suffering from any other comorbid condition along with diabetes need to monitor the blood glucose level. So I will say every diabetic patient need to monitor the blood glucose level so as to keep the blood glucose level in certain range and prevent the complications of diabetes. Now, what are the certain special situations actually where the doing self-monitoring of blood glucose level is very important? I think the most important that I can tell you is the patients who are prone to develop the hypoglycemia. Hypoglycemia means reduction in the blood glucose level less than 70 mg/%. So this kind of patient, they are vulnerable for developing the complications of diabetes. If patient is developing the repeated hypoglycemia that we commonly observe in type 1 diabetes or maybe in type 2 diabetes, this kind of patient, they should be motivated for doing the self-monitoring of blood glucose level. Patients who are having infection, patients who are traveling, patients who are under stress. So these all patients, they need to do the self-monitoring of blood glucose level. Then adjustment in medication, then nutrition, physical activity, then any patient who is having worsening of HbA1c value. So these all patients, they need to do self-monitoring of a blood glucose level. And of course, the most important thing about SMBG is when patients they are doing the SMBG, so at the same time, what exercise protocol they are following, what diet they are following, what medication changes their doctor they have made. So these all things they can be assessed by patient himself. Take an example, if today's fasting blood glucose level is take an example 200 and doctor asked to step up the insulin dose by 4 units, and next morning you will see the patient's blood glucose level fasting comes 130. Patient will be very happy and he himself will assess that my blood glucose level has gone significantly down. Okay, and the most important thing is special condition that basically recommends of doing the multiple sugars in a day is the gestational diabetes. Now, what are the glucose targets? Now, when patients they are doing the self-monitoring of blood glucose level, they are educated about the targets of blood glucose level. As we have seen the diagnosis of a diabetes, that is different from the targets. You see, fasting blood glucose level, we usually tell patient, you keep your fasting between 80 to 120. So that is the target for your fasting blood glucose level. Okay, you keep your post-meal blood glucose level maybe less than 180 mg/%, and the bedtime blood glucose level, again that is one of the important parameters that need to be assessed and it need to be kept between 100 to 150. So these are the target which every patient should try to achieve. and I am sure actually if you are achieving the HbA1, fasting and prandial blood glucose level to this value, I am sure that you are not far away from the American Diabetes Association goal of HbA1c 7% or maybe American College of Clinical Endocrinology given goal of 6.5%. Now how to do the SMBG, self-monitoring of blood glucose level? A simple device, a glucometer, is an electronic device that we are using to test the blood glucose level. There are multiple models are available in the market for checking the glucose, like One Touch or maybe AccuCheck or the Contour or maybe Abbott Freestyle. There are different kinds of glucometers available in the market, which ranges from maybe 600, 700 rupees to maybe 2000, 3000 rupees. So depending upon the affordability of a patient, I think they should start doing the self monitoring of blood glucose level. Now how to do the self monitoring of blood glucose level? Patient, before using glucometer, they should wash their hand properly. Second important thing is they should take out the glucometer, take out the strips, and most important thing is put the strips in meter. And once if you put the strips in meter, before that you have to check the calibration. We have to check whether it is properly calibrated or not. Second thing, prick the side, side where you are going to prick. Okay, prick side of a clean finger tip. Side of a fingertip need to be done. This is the side of my finger basically which need to be pricked. Then press the finger to get more blood. My request is actually, press slowly. If blood is not coming, you re-prick it or reset your lancet. Okay, then touch drop to the front of a glucometer strip where there is a slot for blood drop. Okay, and read the blood sugar result in a meter, and that gives you a simple idea about your glucose control. Now, what to do to reduce the pain while testing? Whenever it comes to checking the blood glucose level, we are always worried about the pain. But remember, there are certain things that you can do to reduce the pain. The first important thing that you can do is use new lancet for each blood glucose check. Now this is a very important, because repeated use of lancet even in the same person can cause actually more pain with increasing number of pricks. Choose a lancet device with depth gauge. Then lancet comes in a variety of size, typically from 28 gauge to 33 gauge. So choose a lancet with smaller gauge, which will give actually light prick. Then poke the side of a fingertip instead of the end of the middle finger. Take an example. This is the end of a middle finger. Rather than pricking here, one should prick side. Okay. Alternate finger instead of repeatedly using the same finger, because if you are repeatedly using the same finger, chances that you could have pain at that particular size. To minimize the pain from forceful squeezing of the fingertip to get a sufficient blood sample, you have to squeeze the finger a bit. But remember, if you are too much squeezing, it can also give a false reading. So it is also recommended not to squeeze too much. Easily if blood drop is coming, that is okay. Then consider alternate site testing, especially if you have painful upper extremity neuropathy, which is quite common in diabetes treatment. What are the precautions that one should take? While using the strips, you should check whether your expiry they are not, whether your strips they are expired or what. That you have to check first. It happens quite a lot because we purchase a bunch of 50 test strips. Okay, but sometimes it happens actually you may use it beyond 1 year, and sometimes you find that those strips they are expired. So when you are using expired strips, no matter, sometimes you may get a report, but that may not be a correct one. Avoid extreme temperature. Then sugar, diet and alcohol. Avoid, whenever you are applying the antiseptic, take care that your finger is not wet when you are applying the lancet. Then take care that your meter is good. You are not dehydrated. And the most important thing is not enough blood applied on the strip. When you are applying the blood, sometimes what happens, you are squeezing the blood, and if adequate blood is not coming, you are just trying to apply that blood to the glucometer. So that inadequate blood which you applied to the strip can also give spuriously wrong reports. What are the benefits of self-monitoring of blood glucose level? Now, if you are keeping your blood glucose level as close to normal as possible, you are reducing the complications of diabetes, like microvascular complication, macrovascular complications like damage to the eyes, damage to the kidney, damage to the nerves, damage to the heart, then damage to the brain, damage to the peripheral vessels of a body, or maybe there are multiple other benefits. But you remember, all vital organs in the body, they are damaged by the diabetes. But by doing the self-monitoring of a blood glucose level, you can maintain your blood glucose level in a target which I just now mentioned. You are actually preventing the complication from that particular patient. Okay. Then the next important thing is, once if you are doing the self-monitoring of a blood glucose level, take an example, you are getting treatment under some doctor and that doctor has asked you to go for the self-monitoring of a blood glucose level. Every hospital, they are providing you a chart where actually they are mentioning you about the blood glucose level during the different timings like fasting, post-meal, pre-breakfast, post-breakfast, pre-lunch, post-lunch, pre-dinner, post-dinner and early morning. So this kind of chart is there, and along with that, the insulin dosage or the oral anti-diabetic drugs. So these all things are there. So what you need to do, whatever changes your doctor, they are suggesting you telephonically or maybe by using WhatsApp or a text message, that thing you need to document in that particular log. And once if you are going for follow-up visit to your doctor, you just show this SMBG log to your doctor, and that doctor will actually tailor-make your treatment depending upon the self-monitoring of blood glucose level log which you have produced in last maybe week or fortnight or a month or so. Okay, so SMBG as a diabetes self-management education tool, I think SMBG enhances disease awareness among the patient, helps patient to gain knowledge about the disease, skill and motivation to modify, adopt and maintain the healthy behavior and lifestyle, helps the patient to understand the influence of exercise, meal, stress or whatever medication prescribed by the doctor. And most important thing is, it is creating a sort of confidence in the mind of patient that my glucose is in control, and so I am a person who is a complication free or least likely to get the complication of a diabetes. So here actually I would like to two more important things. So this is the self monitoring of a blood glucose level. But at some point of time, there are few patients who are showing too much fluctuations in the blood glucose level. Like sometimes blood glucose 500, sometimes 300, sometimes 40. So this kind of profile we see quite often. So for such a patient actually we recommend to go for the continuous glucose monitoring device. So continuous monitoring of a blood glucose level device or ambulatory blood glucose profile. These are the device which can be applied to a body basically, and which gives you a assessment of minute to minute blood glucose level or the kind of a fluctuations that are happening in the blood glucose level. They can be captured by doing the continuous glucose monitoring system, and accordingly the healthcare professional can actually tailor-make the therapy for that particular patient. And this is, I think, quite useful tool that we have invented in the recent past along with SMBG. This tool is also giving much more information about control of diabetes. With this I will conclude. Thank you very much. Gajan, see if there are some questions.
Oh.
We'll answer those questions if questions are there. You can read those questions.
आता त्यांनी क्वेश्चन कोणी विचारलं की ग्लुकोमीटर कोणतं चांगलं आहे.
Mr. Praveen Pandey has asked the question, diabetes patient who had suffered from COVID-19, what are the post side effect and how should take care? I think Mr. Praveen Pandey, this is the excellent question, because in current pandemic we see quite a lot number of patients who are suffering from the who have suffered from the COVID-19, and because of COVID-19 they are showing too much fluctuation in the blood glucose level. Now the most important thing for not to have a COVID, or if those who are having COVID, for both the patient, I think self-monitoring of a blood glucose level and keeping your blood glucose level fasting less than 120 and post-meal less than 180, you can surely prevent the complications of COVID which are happening subsequently. Many of our patients actually, we have seen quite a lot number of patients who have suffered cardiovascular disease or many other complications post-COVID because they were not able to keep their blood glucose level in control. So my request is actually you try to control your blood glucose level. If you are controlling the blood glucose level, you are preventing the post-COVID complications, and those who are not having COVID, they can prevent occurrence of COVID in them. Second question is, which is the accurate glucometer? I think, okay, fine. Now, see, all glucometers are good glucometer, but currently in the market, there are some glucometers available like a plasma calibrated glucometer. So I think these are the best glucometer. And if at all you are using the routine glucometer, so any glucometer, they had a difference of only 10 to 15% from the value which you are getting in a glucometer. Take an example. Suppose if your glucometer value comes 100, we interpret it as a laboratory value of 85 mg/cent. Okay, so being a clinician, when I'm taking into account the blood glucose level done by the glucometer, we always consider 10 to 15% lesser value as compared to the values which you have got in your glucometer. So I think all glucometers are good, but plasma calibrated glucometers, they are quite good and routinely used. Mr. Amol Maske, sir, can diabetes patient consume jaggery? Please guide. Thank you. Amol, no patient can take the jaggery or even